This is Ashley at Portland Wellness Care, and I wanted to talk today a little bit about whiplash, some of the symptoms you might expect, and then some ways you can address home care while you're dealing with some of the symptoms that you're experiencing after an auto vehicle accident or some other kind of traumatic injury, usually involving extreme extension or flexion of the neck, which is causing damage to local tissues. To be clear, whiplash involves just kind of soft tissue injury, meaning the muscles and maybe the ligaments might be partially torn or in some way damaged, creating a lot of local inflammation, but there shouldn't be any fracture or any dislocation of any joints or any bones in the neck. If you have experienced an auto vehicle accident or some kind of high impact injury that caused that sort of motion in your neck, it's very important to get a proper evaluation at an emergency facility and urgent care like the Portland Urgent Care right next door, or even your primary care provider, to make sure that nothing serious is going on, nothing more serious than whiplash. Once you've started to see your provider and it's been established that you just have whiplash in the neck, meaning again, injury to those muscles and soft tissues, there's a few ways you can start to deal with those symptoms at home. Some things to expect to feel are a lot of increased pain, especially with certain movements, quite a lot of stiffness, and you might also notice some slight feeling of swelling or even kind of very obvious swelling or bruising or redness. And sometimes you might feel hot in the area, like the tissues are extra warm. So if you're noticing some of these symptoms, that's a good sign that you might be dealing with some muscle strains or ligamentous sprains in the neck. If those are what you're dealing with, and you might also, by the way, you might feel some headaches, or you might notice a little bit of extra symptoms around your jaw and your temple area. So if you're feeling any of these things, this video is going to go through a couple options for how to start to mobilize your neck. Sometimes with whiplash injuries, a collar or a neck brace is recommended to provide extra support. And while that extra support can be very helpful, especially in the early stages, research is showing that it's really important to include mobilization to the neck muscles and joints to maintain proper movement so that as you recover, you can return back to your normal functionality with your neck. With longer term bracing, it's been shown that outcomes are worse in the long term as far as pain and disability. So really important to get moving, even if you are using a brace, to also remove the brace at certain times and specifically apply different stretches and mobilizations to the neck. So first mobilization I'd like to show is just very, very gentle and light stretching of the neck musculature. This should be completely in the kind of pain-free ranges. So in the very beginning, you're likely not to be moving very far compared to what your normal range would be. To test out just stretching the sides of the neck, just let your ear fall towards your shoulder as far as it naturally will go without causing any pain. If you need any extra stretch, which you might not early in the stages of your injury, but as time progresses, if you need extra stretch, you can always use your arm, reach down and hold on to something like a band, hold the underside of a table or chair, or even hold a light weight, even a bottle or something like that. Another option is to let your other hand rest on the top of your head and allow gravity and the weight of your arm just to gently apply some traction. Don't apply any extra traction until the muscles have recovered enough to be able to tolerate the stretch. Again, this should be relatively pain-free. Other directions you can go in your self-stretch could be chin towards chest or chin towards a collarbone. Again, with the hand just lightly resting on the head, applying a little extra weight as needed to create a little more of a gentle stretch. Another important motion will simply be your normal active range of motion, which just means how you move your head and your neck on your own using those muscles. As part of muscle recovery, we need to activate them so they start to heal better, there's more circulation, and things get stronger faster. So in the beginning, you'll want to move only through the pain-free ranges, which again might be pretty small. So you'll just be turning your head from side to side as far as you can go, and use your eyes to start to cue in your neck muscles as they kind of synchronize with the movement of your neck. So turn your eyes with your head. Looking up, looking down. Another thing to increase the strength in your neck muscles as they start to recover is called isometric muscle loading. So that basically means not moving your neck, but pushing against something with your neck still staying in the same position to make the muscles active. So for example, if I want to bring my chin into isometric flexion, I'll have my hand against my forehead, resisting back, and I'll push my head forward into my hand so that my hand is resisting the motion of my chin coming down. So this would be isometric resisted flexion. If I put my hand behind my head, gently push my hand forward and push my head back into my hand, that will be resisted extension of the neck. We can do this in all direction, to the side, and then also in rotation, trying to push back to center and then turning away to resist that. Again, the resisted motion should be pain-free for as much as possible, and as time progresses, you should be able to go into slightly larger ranges of motion with your stretches and with your active ranges of motion, and over time things will be recovering better and better. So this is a really nice way also to track your progress and to see how you are recovering over time. Another useful thing to apply is heat and ice. Ice is a really nice way to help slow down the inflammatory reaction so there's less rapid swelling and less pain in an area. But you also want the inflammatory reaction to continue as it's supposed to so that things actually get better. So this is where heat is really helpful to apply. At our clinic, we like to recommend alternating between heat and ice. We usually suggest with this type of contrast therapy that you start and finish with the heat. So a few minutes of heat in the area of your complaint or your pain, take it off, a few minutes of ice, using a towel between an ice pack and your skin to protect you. With icing, make sure you follow an arc of the sensations you experience. In the beginning, you'll just feel coldness. The second sensation you'll feel with icing should be a slight burning sensation where the ice pack is. Then you might notice a deeper aching sensation, and eventually you'll feel numbness in the area. Once you reach numbness, you're at the end. You should remove the ice and let your skin return to normal temperature there. With contrast therapy, we only recommend using it for a few minutes at a time with each of these modalities, switching between heat and ice to create a little bit more blood circulation in the area and to reduce the pain and stiffness. At this clinic, we also usually provide TENS units, which is electrical stimulation to all patients who have had whiplash accidents or injuries. So that's just involving, again, electricity lightly pulsed through the body to create an increased healing reaction and to accelerate kind of the improvement of the tissues there. So these are some ways that you can treat yourself at home in between office visits to see your care providers and physiotherapists to help you improve your motion and improve your muscular strength and health following an auto accident or some other injury that caused whiplash. I hope this really helps. Thanks very much.